We're talking about laser and ice today. And while I was thinking about what I wanted to share and present with you, the song from Foreigner, one of my favorite rock bands of all time, came to mind. You're as cold as ice. And so I just went ahead and entitled this, You're as cold as ice. Are you willing to sacrifice your patient's healing? And what I'm finding out and in talking with clinicians and trainers and others from around the country that, we're using ice quite a bit on injuries just because that's the way we've always done it. Now, you may hear that meowing in the background. Yes, I'm at my home office and my young kitten, 6-month-old kitten, is in heat. So isn't that the beauties and the joys of doing Zoom webinars from your home office? You have cat noise in the background. But hey, let's push through that, people. Let's get to the business here. Let's get down to talking here. So yeah, Foreigner, one of my favorite rock bands, songs like Urgent, Hot Blooded, Double Vision, Waiting for a Girl Like You. But, my favorite of all time was, I Want to Know What Love Is. And so yeah, let's not be as cold as ice and let's not sacrifice our patient's healing. My goal today, it's a short webinar, but I've got some good information to share with you. I want you to use ice less and maybe even consider not using ice at all. And I want you to use laser therapy more, always to manage acute injuries. And so these are going to be acute injuries that you see in your practice, whatever type of practitioner you are, whether you're treating the general public or if you are treating athletes or whatever kind of injuries that you see in your practice, that you see in your professional life. I want you to use ice less and laser therapy more. And on the screen there, you see the 3 beautiful lasers that we offer from Sumas Medical Laser. Starting on the left, the H1 is a beautiful, nice, compact starter unit, class 4 therapeutic laser. Uses all of our lasers are going to have a red wavelength, which is great for any superficial conditions. But then we're going to be using 2 or 3 or infrared wavelengths. So that H1, that beautiful little compact laser on the left, is using infrared wavelengths of 810 and 915 nanometers. Then in the middle, the Platinum 4, what a beautiful laser. It's got all the software and the protocols broken down by region of the body, body part, indication, pain level, skin tone, etc. So a wonderful laser, has the presets in there built in for you to treat both those acute and chronic injuries. And then the latest laser system that we've launched on the right is the Horizon. And I want to say a few more things about the Horizon laser when we get towards the end of the webinar here, but that Horizon laser system is something else. I've been able to use it a little bit, and we have quite a few of them out there already in the market being used in practices. And the feedback that we get from that laser system is phenomenal. It's just a beautiful, beautiful laser system. You see on the front there, it has that tablet, which is for built-in video conferencing. It's to show patient education videos and treatment videos. And then you see on the top is the camera. And with that, we can do virtual training sessions. We can do virtual support sessions right through the laser device. There's nobody else does this. Nobody else can do that. Sumas does. We do that. We're good at that. We're the best. Now, okay, so let's jump into our topic here. Why did we use ice? And I phrase that question in the past tense because I want you to start thinking about the ice as being in the past and laser is the present and the future. Why did we use ice? Well, we used it because it decreases pain and swelling. It decreases inflammation. Applying ice helps to relieve muscle spasms and reduce post-exercise muscle soreness. And it's best if used immediately after exercise or after a pain-producing activity. How did we apply ice? Well, we had various ice packs or, maybe dunk the athlete in an ice bath or, what I used in my chiropractic practice. I'm a 1996 Palmer graduate. I practiced chiropractic for 10 years. I don't practice anymore. I'm the medical director for Sumas Medical Laser. So what I like to do, I enjoy living vicariously through all of you doctors. I love interacting with you about various clinical topics. And so the way I did it back in the Stone Ages, when I, when I practiced, I would use a massage cup. I just had a number of paper Dixie cups in my office freezer. And if somebody came in with a situation where I felt I needed to use ice, pull out the Dixie cup, peel back the paper and rub it on until their skin gets numb. So I was always a big fan of the ice massage cups. Or you have the various cooling sprays that I don't think they get used quite as much anymore. What are the effects of ice? Well, what did it do? It helps to decrease circulation, decrease metabolic activity, decrease inflammation, and it numbs the skin. So because of that, that's why we did use ice on those acute injuries. So in digging into the topics here, I think it's kind of interesting to look back in the history, and I found some interesting information online that until 2 centuries ago, ice was just an unfortunate side effect of winter. It's kind of crazy, isn't it? But in the early 1800s, one man saw dollar signs in frozen ponds. Frederick Tudor not only introduced the world to cold glasses of water on hot summer days, he created a thirst people never realized they had. So until that guy came along, Frederick Tudor, until he came along, we were just, or the folks back in that time were just drinking warm drinks, warm glasses of water, etc. So next time you have a cold beverage on a hot day, you can thank Frederick Tudor for introducing us all to the concept of using ice in our drinks. John Gorey, a medical doctor, was granted the first U.S. patent for mechanical refrigeration in 1851 for his invention of the first ice machine, which he actually invented 6 years earlier in 1845. He's considered the father of air conditioning and mechanical refrigeration, but he was ridiculed for it at the time. It's kind of interesting how it goes, isn't it? When you are a trailblazer, when you're at the forefront of things, when you're striking in new territories, people make fun of you. And when I read the story of Dr. Gorey, it reminded me of the journey that we have been. Those of us who are proponents of class 4 laser therapy have been on somewhat of a similar journey. Back in the mid 2000s, 2005, 2006, 2007, when we were just launching this concept and this idea of class 4 therapeutic laser into the healthcare industry, we had so many people, scores of people that would ridicule us for using such a high-powered laser. Well, you know what? Now today, it's standard of care. It's becoming standard of care in both human medicine and in animal medicine. These class 4 therapeutic lasers are helping so many people recover from pain and inflammation and injuries. We were ridiculed back in 2005, 2006, but now today in 2021, it's becoming standard of care. So I thought that was very interesting. And another thing that I'll be very, very thankful, last year here in Scottsdale, Arizona, we had a record-breaking summer. We set the record for the number of days over 100 degrees. So I'll be thinking of Dr. Gorey when we have those hot days coming up this summer. So kind of interesting also to look back at the use of cold as a therapeutic agent. Has a long history. It was actually used back, the first record is back in 3500 BC, where the first recorded use of ice was recorded, or it was known of. And there's that papyrus going back to 3500 BC, making references to the use of cold as a therapeutic agent. And they would use cold to treat inflammation. And then you've got Hippocrates, using cold to treat swelling and pain, and other instances of using cold for neuralgia and migraines. Then you have the French army surgeon that would take limbs when the soldiers were injured on the battlefield. He would pack the limb, the arm or the leg in ice, and then he would perform the amputation. So he was using ice as a anesthetic agent. And then you have this neurosurgeon, Temple Fay, pioneered human refrigeration as a treatment for malignancies and head injuries. So very, very interesting there. Now, in our treatment of the various sports injuries, I remember at Palmer College back in when I was a student at Palmer College from 1992 to 1996, in our physical therapy modalities classes, we were taught the RICE protocol. And so I put some pictures up here to help you put a little bit of a time frame on this. We've got the Rolling Stones, that's them back in 1978 on the top, and then the Rolling Stones today down on the bottom, just to give you a somewhat of a concept of the length of time that we're talking here. Back in 1978, Dr. Gabe Mirkin released his sports medicine book. And Dr. Mirkin is the father of RICE. He coined the acronym RICE for rest, ice, compression, and elevation to represent the 4 activities for treating acute athletic injuries. And the RICE protocol has been ingrained in the academic curriculum as well as in public perception for over 4 decades. Well, we need to change that. We need to change that. And guess who is leading the charge to change this? It's Dr. Mirkin himself. He has done a complete 180 turnaround on his recommendations here. All right, so we'll get to that point in just a minute. And there we are. Oh, my wonderful cat in the background. I would like to put some ice on her. But anyway, what's the problem with ice? Well, you've got a long-term application of ice is going to could possibly lead to frostbite or result in other tissue damage. For me in my chiropractic office, when I was recommending ice, guess how many of my patients would use the ice the way that I recommended it? What percent of my patients would you guess actually used ice the way I told them to? If you said 0, you are correct. I would always tell them in the way that we were taught, 10 minutes on, 10 minutes off, 10 minutes on, 10 minutes off. That's the way that you properly use ice. Because it's not, you know, the theory behind ice is not just the application, it's not just the chilling effect, but it is the alternating temperatures that is helping to increase circulation and give all the other beneficial effects of using ice. But time after time, I would hear back from my patients on their second visit. Hey, doc, I put that ice pack on for 2 hours last night, and I'm still hurting. And I was like, oh, come on. You need to listen. So the thing I like about laser therapy is that it's a clinic-based modality. We are delivering the treatments in the office so that we can control the dosage and the treatments. All right, so here we go. Dr. Mirkin, on his website, drmirkin.com, he has a full blog post on why ice delays recovery. And he starts out there, when I wrote my best-selling sports medicine book in 1978, I coined the term RICE for the treatment of athletic injuries. Ice has been a standard treatment for injuries and sore muscles because it helps to relieve pain caused by injured tissue. Coaches have used my RICE guideline for decades, but now it appears that both ice and complete rest may delay healing instead of helping. So Dr. Mirkin goes on to say that when you damage tissue through trauma or develop muscle soreness by exercising very intensely, you heal by using your immunity, the same biological mechanisms that you use to kill germs. This is called inflammation. That's the process of inflammation. It's a local immune response from the body. When germs get into your body, your immunity sends cells and proteins into the infected area to kill the germs. And when muscles and other tissues are damaged, your immunity sends the same inflammatory cells to the damaged tissue to promote healing. So inflammation is a necessary process for healing. So Dr. Mirkin goes on to say in his blog post, anything we do that reduces inflammation is going to delay the healing process. Why would you want to delay the healing process? Anything that reduces your immune response to an injury is going to delay muscle healing. It's delayed by cortisone type drugs, the steroid injections, all pain relieving medicines, including the non-steroidal anti-inflammatory drugs like ibuprofen. Other things that are going to suppress your immune system and delay healing are immune suppressants, such as those that are used to treat arthritis, cancer, or psoriasis, applying cold packs or ice, or anything else that blocks the immune response to injury. So when we have that acute injury and we put ice on there, we are actually blocking the body's response to it and delaying the healing. So what else happens? Ice also reduces strength, it reduces speed, reduces endurance, and reduces coordination. And in his blog post, Dr. Mirkin goes on to talk about a study that was done that confirms this. And they say, the authors of this study go on to say that they recommend that if cooling is done at all to limit swelling, it should be done for less than 5 minutes, followed by progressive warming to returning to play. So I think it's very, very interesting that Dr. Mirkin, the gentleman that coined this concept of rest, ice, compression, and elevation back in 1978, now he wrote this blog post in 2015, but man, the message needs to get out there. We need to get this message out that using ice on acute injuries actually delays healing. So what do we need to do instead? We need to use laser. Here's one of my favorite studies on this topic, and they're looking at, it's a small animal study, looking at a combination of laser therapy and cryotherapy, using them either singly or together for Achilles tendinopathy in rats. So let's take a look at this paper, and this is published in Photomedicine and Laser Surgery. If you're a study person and want to look this up, you can go to Photomedicine and Laser Surgery. It was published in 2017, and Mary Ann Liebert is the publisher of that article, or of this journal. So a few things to point out here. They were using a gallium aluminum arsenide diode laser. It was using a single wavelength of 810 nanometers and delivered only at continuous wave. And just one comment to make here, when you look at treatments on animals, or you look at animal studies, of course, they're tiny little beings. Your laser parameters are going to be much smaller, much lower power settings and lower dosages and shorter treatment times. Obviously, it's much different in treating a mouse or a rat for a small animal study versus treating one of your athletes or one of your patients in your practice. Okay. So just that comment there, that these small animal studies are fantastic because they show us what the physiological and clinically relevant effects of laser therapy are, but then we have to make that translation to treating our actual human patients. So in this study, they injured the Achilles tendons, and then they would either put ice or laser in different orders of application. Either ice alone, laser alone, or using the two in conjunction with each other. And here we see the histological responses from that study. So top left, you have the control group. Those are the ones that did not undergo any type of procedure. And so for those of you that are real skilled in reading histology and in histological slides, great evidence here. Great to show you that objective evidence in the histological study of what's happening here when we have the control group, the injury, using the ice and using the laser, and then using them together. So I don't think I did very well in my histology class at Palmer College, but anyway, I graduated and I have my degree, and that's a whole nother story. All right, so anyway, top left, CG is the control group. Then we have ING, that's the injured, non-treated group. So we can see, even a rookie like me, and an amateur like me looking at this histological slide can see that there's a problem there. So those animals underwent the tendon trauma, but then got no treatment whatsoever. Next one, LG, is the laser group. They underwent the tendon trauma, and then they received a laser treatment 1 hour after injury. And then the next one beside that, CTG, is the cryotherapy group. Those animals underwent tendon trauma and 20 minutes of cryotherapy 1 hour after injury. And then at bottom left, and this is where it gets really interesting. Bottom left, because they adjusted the order. Okay. All right. So the two pictures in the middle, laser alone and cryotherapy alone. And then at the bottom, they're using them together. But look at what they're doing here. Bottom left, LCG, those animals underwent the tendon trauma, and they got laser first and then 20 minutes of cryotherapy. And then at the bottom right, those animals that had the trauma, they did 20 minutes of cryotherapy followed by laser therapy. Okay. And you can see, if you look closely at those, especially kind of in the upper left of that LCG group, you see how there's not complete and efficient healing, whereas the CLG, the group that did have a little bit of ice followed by laser, they performed the best. All right. So your order of application makes a difference. Conclusion of the study. Very interesting to see this. Our results demonstrate that cryotherapy in combination with laser can produce an anti-inflammatory add-on effect. The order of therapy administration seems essential, as superior histology and biomechanical results were found in the cryotherapy first, laser second group. All right. So my message for you today, I mean, actually, I really want you to consider not using ice at all. I want you to consider using laser only. But if you are going to use ice, if I was back in active practice treating patients with acute injuries, probably what I would do is use that ice cup for about 5 minutes to get that nice cooling effect on the tissues, but then I would follow it up immediately with laser. All right. As they say in that study, cryotherapy before laser induced positive interactions with mechanical behavior closest resembling healthy tendons and near normal histological appearance. Cryotherapy after laser, however, displayed the poorest mechanical behavior and histological score of all the groups. All right. So the order of application is so important here. Ice first, laser second. Ice first, laser second. And I didn't spell it out on the slide here, but there's more reasons why we do that. When it comes to performing a laser treatment, one of the things that we always talk about are the the effect that we have on circulation in the tissues. And when we get to my slide on the effects of laser therapy, one of the real big benefits that we get is that enhancement of tissue circulation. And it's always important to emphasize that we're not talking just about the arterial blood supply going to the area, but also the venous and lymphatic return away. It's the complete cycle of circulation that we are helping. We are getting localized release of nitric oxide, which is a very, very powerful vasodilator. So when we have that trauma, it activates the sympathetic nerve system, which causes vasoconstriction. All right. So when you're dealing with that sprained ankle, that trauma to the lower extremity has caused vasoconstriction. All right. So we treat it with the laser. All right. Treat it with the laser, get that increase in circulation, and we help inflammation and help with pain. So if you then apply ice afterwards, you are counteracting what you just did. You're counteracting the benefit of the laser. So my recommendation to you, if you are in private practice and seeing patients, my advice to you is, if you laser someone, tell them they should not use ice for up to 48 hours afterwards. If you ice after laser, you're wasting your time and you're wasting the patient's money. It's just not a good situation at all. So I would say, if you are going to use ice, ice first and laser second. Now, as I said, I started out earlier in this webinar saying that back in 2005, 2006, 2007, at various conferences, and one of them, the North America Association of Laser Therapy meeting, where we have, laser people involved in laser therapy from all over the world there, actually, we would be ridiculed because we were using class 4 therapy laser. And there was always this, somewhat of a perception in the group that class 4 laser was bad and that it was going to injure people and burn people and that it was a bad thing. Well, I tell you what, it made my day. This paper, this guest editorial was published in 2019. And these 4 people that authored this paper, these are like the Hall of Fame of laser therapy in the world. All right. Doctors Juanita Anders, Pravi Narani, David Baxter, Raymond Lanza fame, all big heavy hitters in the field of laser therapy around the world. And what did they say in their article, their guest editorial from 2019? They said something that I myself and we at Sumis Medical Laser, we've been saying this for years. It's important to note that laser therapy is commonly and incorrectly thought to refer to the power of the laser. Historically, when this term was introduced by Calderhead, it referred to the level of the tissue reaction to the dose of light delivered. Low-level laser therapy was defined as a dose of light that is below the level of damage threshold and causes cellular photoactivation. And they go on to say that in this article, or in this editorial, photobiomodulation therapy is not defined by the output power of the device used, but by the effective dose delivered to the target tissue. Photobiomodulation therapy is performed not only by Class 3B lasers, both Class 3 and Class 4 devices are being used successfully to treat patients in human and veterinary medicine. Wow, fantastic. I've been saying that. We at Sumis Medical Laser, we've been saying that for years, over a decade. And now finally in 2019, these heavy hitters in the field of laser therapy finally come out and say, yes, Class 4 therapeutic lasers are being used successfully to treat patients in human and veterinary medicine. And this closing sentence here is so critical. It really sums it up very well. An important advance in photobiomodulation therapy was the recognition that optimization of transcutaneous therapeutic parameters should be based on the photonic dose reaching the target tissue. And that often requires higher doses of light at the skin surface to reach deeper tissues. Yes, absolutely. Fantastic. If you want to treat something that is very, very deep in the body, you have to shine a brighter light at the skin surface. How do you get a brighter light with the laser? You use a Class 4 therapeutic laser from Sumis Medical Laser. Now, another way that I was just, when I got this email, when I saw this email chain and read this, I was floored. I was ecstatic. I was so happy when I read this email. This comes from a Major League Baseball head trainer, and he was commenting on the use of laser versus ice. And as I said, very exciting time of year. I have my tickets bought for a couple of spring training baseball games. Really looking forward to getting out there and you know, watching baseball again. It's just fantastic. It's an awesome time of year, folks. If you come to Scottsdale, Arizona, give me a holler. Let's stop by and visit. Let's go have lunch somewhere. Scottsdale is a beautiful place. Maybe I should point out, I'm not getting paid by the Scottsdale Chamber of Commerce, but yeah, come on out and visit. So anyway, back to this. This head trainer, Major League Baseball head trainer, said, we're using ice a lot less now. Only older guys that came up using ice. And it's only 2 players on the whole team. So just the old guys that had been treated with ice when they were, you know, coming up through the system, the minor leagues, and then in the majors. And just because that's the way they've always been treated, they wanted to continue to get treated that way. So baseball players, if you know a little bit about them, they can be superstitious. You know, so I've heard, you know, stories of them, you know, wearing the same pair of socks. As long as they have a hitting streak, they'll wear the same pair of socks, maybe not even wash them, or, you know, different superstitions. And I would classify this, you know, these old guys that with their injuries that wanted to keep on using ice, you know, they would ask the trainer for ice. It's more just because it was a superstitious thing, just because they had always done it that way. But now it's so encouraging for me to hear from this Major League Baseball trainer that they're, you know, primarily they're using ice. And you talk about acute injuries, you know, baseball, you get, you know, hit by pitch, you've got pitchers and catchers and you know, anybody, you know, throwing the ball, you've got those acute injuries to shoulder, the elbow, the wrist, the hand, you know, walking acute injuries in that Major League Baseball complex, and they're using the laser instead of ice. That's fantastic. Well, oh, what about tissue heating? And this is something that it really bothers me. Unfortunately, we have people in our chiropractic profession. If you are a chiropractor and if you attend webinars or go to conferences, you'll see some people lecturing on laser therapy that say, oh, don't use Class 4 laser therapy on acute injuries because you're going to warm it up. False. Fake news. That's not true. With the proper settings and the proper treatment technique, there is no tissue heating. If you have that sprained ankle, that sore shoulder, that strained hamstring, any acute injury in the body, when you're using the proper settings in your device, whether it's a class 4 therapeutic laser from Sumis Medical Laser, or if you're using any other brand of a class 4 therapy laser, your proper settings for acute injuries, there is no tissue heating. So yes, use your class 4 therapy laser on those patients. Yes, you will help them. And no, there is no tissue heating. So any of those acute injuries, get your laser on there as soon as possible. Educate your patients. Tell your patients. Make sure they know if they get injured, family member gets injured, friend gets injured, get laser on there as soon as possible. So what's happening? I always like to have a little elevator pitch. Make sure that you can give that quick answer. If you see somebody in the elevator or in your Uber or in the grocery checkout line or anywhere you come across someone, what does laser do? It enhances circulation. We talked about that earlier in the webinar. Not just the arterial blood supply to the area, but the venous and lymphatic return away. Better circulation creates healthier tissues. I think any patient would understand that. The second effect, more oxygen getting released to those tissues. Anybody would understand that increasing levels of tissue oxygenation is going to help the body to heal. Tissues need oxygen levels to help fight infection and help to have a normal local inflammatory and local immune response. Also, increased levels of tissue oxygenation are going to help those cells produce more energy. So in every single cell in your body, you've got hundreds of mitochondria. When those engines of the cell, when those mitochondria are producing more energy, the cells will be more efficient, the tissues will be more efficient, the organs will be more efficient, and the body will be more efficient. So better circulation, more oxygen to the tissues, and the cells produce more energy. And what are the physiological effects? Pain reduction, inflammation reduction, and accelerated tissue healing. So pain, inflammation, and damaged tissues. Those are the three main physiological effects of laser therapy. Now, just a little comment here. Myself, when I started to use laser therapy in my practice, I started to use lasers in 2005. I did not use ultrasound at all. So if we do a comparison here and we look at the effects of laser compared to ultrasound, if you are still using therapeutic ultrasound in your practice, I would highly encourage you use laser instead. It's okay to treat over metal implants, whereas ultrasound, you cannot do it over metal. Laser, you can. Laser is light. Light will not heat up the metal, okay? Light will get reflected from metal. It's not going to heat it up. So if you do have a question about that, what you can do is actually take any metal object. You can take a pair of scissors, your reflex hammer, a tuning fork, hold it in your hand, and then shine the laser on the back of your hand, and you will see that it does not heat up the metal. So if you have that question yourself, or if a patient questions on you on that, or even the surgeon that did the knee replacement or hip replacement, it is okay to use laser over those metal implants. Laser, we can use it over broken skin, whereas therapeutic ultrasound, you cannot. Laser, it's okay to use on acute injuries. That's my point here today. Get laser on those acute injuries as soon as possible. But what's the recommendation? Therapeutic ultrasound, you have to wait 48 hours. Laser as soon as possible. Laser, it's easy to deliver over irregular body parts, such as the elbow or ankles. And laser, you're shining light. You do not need a transmission gel. And there in the chart there, you see all of the, there are some comparable physiological effects, but laser wins every time. So my message to you, photobiomodulation, laser therapy with a class 4 therapeutic laser, safe and non-invasive. There's no side effects. We can do these treatments that are effective for both superficial wounds and deep neurological conditions. The treatments are appealing to patients. It's a high-tech solution to pain and injuries. It's an in-clinic surface. Remember, I talked earlier about how none of my patients would follow through on my recommendations for using ice when I was recommending that. With an in-clinic surface, you are controlling the delivery and controlling the dosage to the patient, and you should be using it as soon as possible on acute injuries. So use laser on acute injuries instead of ice, please. That's my presentation for today. I want to thank you all for being here. We have one question here. Is the webinar being recorded? Yes, we are going to send out the recording link afterwards.